Hi everyone, welcome to my office. I'm Diana Swain. I'm the Senior Investigative Correspondent for CBC News, and we want to talk about a story that we recently did with our investigative team. And if you want to see the story, you can click on the description box right down there. It will take you to the original story, but essentially we highlighted that there are a number of Canadian women who reached out to us to tell us about what they felt was dismissive, poor treatment in hospital while they gave birth. In some cases, they called it abusive treatment by nurses and doctors. And in fact, when we started doing our investigation, we determined that there had been hundreds of complaints lodged around the country with hospitals and health authorities over 6 years, alleging this kind of a problem. And so we wanted to find out if you had questions about the story, and many of you do. So we're going to try to answer some of those now. So let me start with the first question, which is, let me go right up to the top here. Do you think this is a result of disengagement from patients or a lack of empathy to pregnant women? I think the explanations, frankly, run the gamut. The thing that we heard the most often is that there seems to be a real tension, and this may be the highlight of why this problem is coming to bear now, is that you've got a lot of medical staff who believe that based on their education and their knowledge and their experience, that they know what needs to happen and what should happen next, and women who have decided they want to be in control of that moment. A perfect example was Samantha Powell. She told us that she really wanted to have a natural birth, and she felt pressure to opt for a cesarean section. She said they were in my room every 20 minutes trying to get me to sign forms. She said the forms were held under my nose. You need to do this, you're harming your baby by delaying the cesarean section. She is a labor and delivery nurse who felt she knew what was medically appropriate, but she said she capitulated, she gave in. She felt really bullied in that moment. Those are her words. So I think it's an example of the tensions that exist. Why do you think consent is so easy to ignore in maternity care? I have seen as a doula women ignored who said, stop. The premise of the question for me suggests that consent is easy to ignore and that it's happening all the time. I'm not really sure that that's true. I don't think that we have any evidence that it's easy to ignore or frequently being ignored. Having said that, we certainly did hear from women who felt that their consent wasn't sought before actions were taken, or that it was kind of batted away. Jessica Irvin talked to us about a painful vaginal exam by her doctor, a female doctor, who she said kept her rings on under the gloves when she did an exam, and that Jessica was in fact having a contraction at that moment. For her, she said, I was saying stop, I was trying to yell stop. Someone in the room who was there, a friend of hers, actually reached over to say to the doctor, look, she's saying stop. That is not seeking consent. And she did what you can do, which is exercise your rights in a hospital setting, and she asked for someone else to deliver the baby. And they did, and she said the experience was completely different. Okay, so the next question, how can we hold care providers accountable? Well, first of all, they are accountable, just as any of us are at work. So you can lodge a complaint with their professional association. So for instance, the College of Physicians and Surgeons or the associations that look after nurses. You can complain directly to the hospital, or maybe it's the health authority. It depends where you live, sometimes in the country where the best route is. But if you even type the name of the hospital into Google, and complaints, sometimes it will actually lead you to their complaints process, and you can start on that path. The Canadian Patient Safety Institute suggests, though, that if you don't feel like you're getting satisfaction, in particular if you feel like someone's not taking your complaint seriously, keep pushing. Escalate your complaint, move up the ladder, so to speak, until you hear from someone, talk to someone who you think is taking you seriously, and that's when you know your complaint will get a fair hearing. Why did I have to fight and advocate so hard for the birth that I wanted? Women deserve to feel safe and heard during birth. You're right, they do. Feeling safe is fundamental. If you're in the hospital, it's there because you're actually seeking out help. You should feel safe in that environment. Your consent does need to be sought. There are consent laws in every province and territory in this country. They may be worded differently, but they all mean the same thing, which is that you're actually supposed to be in control. We know that from our reporting that some providers we reached out to, healthcare providers, don't agree there's a problem were kind of dismissive of the fact that women are unhappy. I think the fact that women were using their own voices to say that there is a problem means that at very least we've got a dialogue started, and often that is the point of reporting, getting something out there for people to start talking about. That about covers the questions that we received. We received lots of them. And importantly, I think we should say we received a lot more stories from women who, once they heard these other women share what happened to them, we got tons back through email. We had a lot of people watching on Facebook, people who sent us questions via Twitter. So we know that this is a conversation that women have been having among themselves, and now it's a conversation that hopefully Canadians at large can start having. If you want to see how the story played out when it rolled out, you can take a look right there. Click on the description box and you can see the original story. And of course, if you've got questions once you see that, add your voice to the conversation. We're always looking for that. Thanks.